Hello guys, so now we shall be discussing regarding the fallopian tubes. Okay, so you know one very important thing, that fallopian tubes are also called as salpinx. The other name is called as salpins, or it is also given another name called as oviducts or uterine tubes. Okay, so let us discuss what are the important things that are related with the fallopian tubes. Okay, so we shall discuss about fallopian tubes. So what did I tell you? Fallopian tubes are also called as uterine tubes. They are also called as your uterine tubes. So what is the other name for these fallopian tubes? They are also called as oviducts. They are also called as oviducts, or simply they are called as salpinx. Okay, simply they are called as salpinx. So these are the different terminologies, different names that are given for the fallopian tubes. Now I will show you the picture of the fallopian tube, but before that you have to know few important things, that where is this fallopian tubes present. These fallopian tubes are present on the upper border of broad ligament of uterus. Within the uterus we have got a ligament which is very broad, that is why you call it as a broad ligament. I will show that ligament to you. So let me write down the text first here, that it is present on the upper border of the broad ligament. So it is present on the upper border of the broad ligament of the uterus. Okay. Now next important thing is that this is present lateral to the uterus. Where is this present? This is present lateral to the uterus. Not only lateral to the uterus, what is the next important thing is that this is present near to the ovaries. This is present near to the ovaries. Okay, so this is the one that is present near to your ovaries. Okay, so these are some of the important things that you need to know over here. Now first of all, let us look at the fallopian tube over here. Let us say that these structures which I am drawing right now, these are your fallopian tubes. Okay, so here you have got your ovaries like this, right? Now where is this actually the broad ligament which you told that is present? So actually broad ligament is covering your entire uterus like this. Okay, not only that, broad ligament even covers all the way down here. So this entire ligament over here which is present like a flap, right? So this particular ligament which I am drawing right now, right? So this is your entire broad ligament of your uterus. Okay, so this is your broad ligament of your uterus. Now if I ask you where is the superior border of this broad ligament, what will you tell? See, this is the superior border of the broad ligament of the uterus, or you can also call it as the upper border of the broad ligament of the uterus. So on the upper border of the broad ligament of uterus, you have got these structures on either side. These are called as your fallopian tubes. Okay, so this is one point we have discussed. And second important thing, where are these fallopian tubes located? This center part over here, you call it as a uterus. This center part is called as a uterus. So on either sides of the uterus, which you also called as the lateral sides of the uterus, you have got these fallopian tubes. And next important thing, where are these fallopian tubes located? They are located nearer to the ovaries, right? So that's what I was telling here. First point is it is located on the upper border of the broad ligament of the uterus. Second is it is present lateral to the uterus, and third important thing is it is near to the ovaries here. Okay. Now next important thing, if you can look at this particular picture over here, right? So this picture will explain everything here. Now this particular structure over here is called as your fallopian tube. Fallopian tube. And what is this particular one over here? This is called as your ovary. Okay, and this yellow color broad sheath which you can see over here is called as your broad ligament. Okay, what is this ligament over here? Broad ligament. Now the center part, whatever this bulged area is there behind this broad ligament, that is called as what? That is called as a uterus. Now if you ask what is the function of these fallopian tubes, these fallopian tubes, they assist in transfer and transport of ovum from the ovary to the uterus, which means Let me draw another picture and explain it here. For example, this is a uterus like this. These are your fallopian tubes. Right, these are your fallopian tubes. All of you know that you have got your ovary here, right? Now from the ovary what is released? Ovum is released, right? So this particular ovum which is released from the ovaries will enter into your fallopian tubes, and from the fallopian tubes this ovum transfers all the way back into your uterus. Okay, so it means these fallopian tubes are responsible for assisting in transfer and transport of ovum from the ovary to the uterus. Okay, so let us write it down for our textual purpose over here. So what is the thing? What is the function of this? This assist in transfer and transport. Okay, transfer and transport of ova from ovaries all the way to the uterus. Ovaries all the way to the uterus. One very important thing you need to know is that sometimes, normally pregnancy where the pregnancy should takes place, the pregnancy should take place down here in the uterus. Sometimes what will happen is that instead of the pregnancy taking place in the uterus, pregnancy might sometimes take place within your fallopian tube. The baby starts developing within the fallopian tube. Now obviously when the baby starts developing within the fallopian tube, the diameter of the fallopian tube is very narrow, yes or no? So what will happen as the baby is developing, the fallopian tube will enlarge to a certain extent, and after that will rupture. That is called as fallopian tube rupture, and this kind of pregnancy is called as ectopic pregnancy. Okay, it is happening other than the normal place. Anything which happens other than the normal place is called as ectopic. So this is called as ectopic pregnancy. So this terminology we given here is that ectopic pregnancy. Because of this ectopic pregnancy, what will happen? There will be fallopian tube rupture. There will be fallopian tube rupture. Okay. Now, so in this condition what you do is that whenever a female is coming to you complaining of, see obviously if baby has to develop, baby will develop only on either one of the fallopian tube, either right side or left side. On both the sides babies can't develop, right? So if let us say patient is having ectopic pregnancy on the left side of the fallopian tube, so what will happen? She will complain of very severe left inguinal region pain. Okay, very severe pain in the left iliac fossa here. So obviously you do further investigations, and when you do a fundoscopy, right? So when you do a fundoscopy, inside you won't find any kind of content. First of all, you do beta HCG. Why beta HCG you do? Beta HCG you do to rule out the pregnancy. First of all, whether she is pregnant or not. So you do beta HCG. Beta HCG values will be positive. Maybe it can be more than 1400. Right? If beta HCG values are positive, it means she is pregnant. Now I wanted to see where is the implantation that has occurred. For that, what will I do? I will do a vaginoscopy, right? So I'll put a tube inside the vagina and I'll examine the vagina. Now inside, when I put the tube down, into the uterus, in these patients within the uterus, I don't find any implantation. I don't find any baby growing within the uterus. So uterus is empty. If uterus is empty, then what you need to know? She is pregnant, but uterus is empty. It means that baby is developing somewhere else. Where is that implantation getting developed? That is in the fallopian tubes. Okay. So these things you'll study in OBGY. I'm just told you just a rough thing. If you want to remember it, or else leave it. Now, next important thing regarding anatomy is that, for example, if I cut down the fallopian tube like this, and if I see what are the different kinds of layers that are located, you would see the inner layer as the mucosa layer. What layer you would see the inside? Innermost layer is the mucosa, and this mucosa is having an epithelium called as ciliated columnar epithelium. Not only ciliated columnar epithelium, there are also special types of cells called as PEG cells, PEG PEG cells. Now these PEG cells are having what kind of epithelium? What are these PEG cells actually? PEG cells are nothing but non-ciliated secretory cells are called as PEG cells. So in the inner mucosa, there are two different types of epithelium, two different types of cells you see. One is called as ciliated columnar epithelial cells and the second one is called as non-ciliated secretory cells. These non-ciliated secretory cells are called as your PEG cells. So within the inner mucosa, two types of cells. One is called as ciliated columnar epithelial cells. Okay, one is ciliated columnar epithelial cells. Second important one is PEG cells, PEG cells. What are PEG cells? PEG cells are ciliated or non-ciliated? They are non-ciliated. Okay, what are these cells? These are non-ciliated secretory cells. Non-ciliated secretory cells. These are called as PEG cells. Okay. Now, next important thing after inner mucosa is that next layer we have is the smooth muscle. Okay. So, within this fallopian tubes, if you look here, within these fallopian tubes, you see there is a smooth muscle that is located here, right? So, what is the use of this smooth muscle? First of all, I already told you the function that ova from the ovary, it has to go all the way into the uterus. But ova is non-motile, it is not having any flagella, or it is not having any cilia, or it is not having any kind of pseudopods. Yes or no? So how will ova go all the way till the uterus? It is because of fallopian tube contraction. How is fallopian tube contracting? Because it has got a smooth muscle inside. So it is because of the smooth muscle, the fallopian tube contracts and there is transportation of ova. Not only ova, even the transportation of sperm also happens. Okay. So coming to this, second important thing is it has got smooth muscle. It has also got smooth muscle. And what is the function of smooth muscle? I told you smooth muscle will contract and this contraction will lead to transportation of ova and sperm. Transportation of ova and sperm, right? Now, if you look at this, this is just a rough picture of the fallopian tube which you can see, and let us see what are the different parts of this fallopian tube. Now, first important thing you should note down here is that this is your uterus, okay, and this part over here is called as ovary. Now, within the fallopian tube, there are three important colors you see. So, this particular part over here is called as the isthmus of the fallopian tube. What is this called? This is called as the isthmus of the fallopian tube. Second important thing, this green color part over here is called as the ampulla of the fallopian tube. Okay, ampulla is the place where the fertilization occurs. So, this is a place where the fertilization takes place. Okay, and next, third last important thing, this one over here is called as your infundibulum. This is called as your infundibulum. Okay, now attached to the infundibulum you see finger like projections. These finger like projections over here is called as fimbriae. So what are the structures of the fallopian tube you have got? First of all, starting from the proximal end to the distal, you have got isthmus, you have got ampulla where the fertilization takes place. Next you have got infundibulum and after that you have got fimbriae. Now if you look at the blood supply, so these are the basic arteries that are supplying over here. First of all, let us label what are these arteries. Okay, so this artery seems to be the main trunk. This artery seems to be the main artery. So this artery is called as internal iliac artery. Internal iliac artery is giving one yellow color branch and red color branch. So this yellow color branch supplies to the uterus. So that is why you call this artery as uterine artery. Okay, and this red color branches supply to the vagina. So you call these arteries as vaginal arteries. Okay, and after that you should know one very important thing, that this is called as a aorta. What aorta is this? This is called as the abdominal aorta. Now directly from the abdominal aorta, you see a branch that is coming and supplying to the ovary as well as the fallopian tubes, right? So this artery is called as a ovarian artery. So what is the name of this artery? Green one, ovarian artery. So can I tell that ovarian artery is the one which supplies both to the ovaries as well as to the fallopian tube. So this is the blood supply which you need to know, right? So this is all you need to know regarding the fallopian tube, guys. So thank you so much for watching my video. Goodbye.